Thank you for joining today's webinar. We will give it a few more minutes before we begin. Take a look at your mute button, ensure that you are muted for today's video webinar. Hello, everyone, and welcome to ACF's Faith-Based Roundtable presentation. We are excited to have a dynamic panelist for you today to discuss the relationship and partnership with ACF and the faith-based community. I'm Deborah Johnson, Deputy Assistant Secretary of External Affairs for ACF. Today, we bring together 4 national faith-based organizations to share their models for serving families and individuals experiencing crises, mental health challenges, economic instability, housing needs, and the many other services that connects to ACF's work. Families often turn to their local congregation when seeking services or help. Our panelists will speak to the powerful tool of pairing faith with service and how they can better reach families by having the tools, knowledge, and access to the resources within their communities that can improve how they deliver on their missions. They have spoken to how they could better serve families if they could more easily connect them to prevention services within their communities. Rather than having a family experiencing partner or child abuse, rather it be a family experiencing partner or child abuse or needing energy assistance or childcare. A whole family approach is the ask of our faith-based community to build stronger relationships with ACF for better outcomes. As with any webinar, I may have mentioned early on, take a look at your mute button and ensure that you remain muted throughout the call. You are welcome to be on video and engage via the chat function during the webinar, and we hope you find today's discussion engaging and informative. Our moderator is Lauren Walliser, Senior Advisor in the Office of Regional Operations. Lauren will introduce our panelists and lead them in discussion on a series of questions to dig deeper into the work these organizations do and the many layers of that work that interconnects with ACF. Lauren?
Thanks, Deborah. Johnson. I'm Lauren Walliser. I work with ACF's 10 regional offices on issues like economic mobility and other areas that support resilient families and communities. So I feel like this is a very ripe and interesting conversation for me personally. We're delighted everyone could join us today. I will be moderating the discussion, as she mentioned. We have 4 panelists today. The first is David Aguilar, Executive Director of Catholic Charities Diocese of Baton Rouge. Next is Dr. Denise Berthe, Executive Director of Peaceful Families Project. Next is Reverend Dr. Anne Marie Hunter, Co-Director of Safe Havens Interfaith Partnership. And finally, we have Deborah Rosenblum, Chief Program Officer from Jewish Women International. So the structure of our conversation will be that I will pose a question and identify an initial organization to speak to it, but all organizations are invited to reply if they have something that they would like to contribute to the conversation. And we will go through, we have 6 questions prepared for them to speak about. If anyone in the audience has a question, we do have the chat function available for you to pose it. Our organizations may be able to answer it in the conversation, or if not, we will have ACF contact information at the end of the event that you can send questions to. We can follow up after that event. So let's get the conversation started. So the first question is, what does your faith-based organization stand for? Dr. Berthe, would you like to start and share a little bit about the work your organization does?
Absolutely. So I'm going to talk first about Peaceful Families Project and then a little bit about Islamic values that we use in our work. So Peaceful Families Project is an over 20-year-old nonprofit organization that is focused on the elimination of domestic violence within Muslim communities using Islamic perspectives and models. So we focus on training, research, so that the Muslim experience in domestic violence is front and center, as well as looking at best practice. We use methods for resource development, and then creating strategic representation across the country and internationally as well. We do look at sort of the entire functioning of families. So our Peaceful Families program looks specifically at domestic violence. We have Peaceful Futures, which is prevention for youth, middle school, high school, and university age. We have programs around peaceful partnership, which engages male allies, as well as having a very specific program for batterers, for folks who have been picked up or have been charged with domestic violence. We have peaceful parenting, which looks at non-violent parenting methods. And we have a program looking at peaceful partings, which is divorce and co-parenting, as some of the areas where we know that families have difficulties or get into situations where they're not sort of functioning at their ideal level. In terms of where we are Islamically, Islam is based on core values of justice, especially for the most vulnerable. That is a huge tenet of our faith tradition. We also look at equity in Islam. Men and women, and not only men and women, but people of different nationalities. We are told that we are born of the same soul. So the idea of equality and having equal access to all good things is very important in Islam. The ideals of compassion, of service, and then of course as family as sort of the center point of all functioning. So when we do that work, the things that we are looking at is positively functioning healthy families, gender equity, healthy and safe environments for all community members, and then the right, of course, to basic needs being met: housing, shelter, medical care. And then, of course, the freedom to worship without discrimination, and to have your faith tradition as part of a personal identity that is not in conflict with the world around you.
Thank you. Deborah, maybe you would like to go next.
Sure. Hi, I'm Deborah Rosenblum with Jewish Women International. Our organization was founded in 1897. We just celebrated our 125th anniversary, and we were always there to support women and families. But around 30 years ago, one of our members was murdered by her husband in Bethesda at a federal facility where they both worked, and they were both academics. They had all the trappings of what looked to be a really good life. And there was a lot of shock in the Jewish community about how could this happen in our community. And we set out to do a lot of public awareness to change that narrative and to let people know that this does happen in our community. No community is immune. No one is immune from experiencing domestic violence. And our work has evolved from there. Initially, we were not welcome in national coalitions or national tables, discussions around violence against women, because faith was considered to be a barrier to understanding and to accessing resources. In other words, you as a faith person, you married under the divine, under God. It was a holy relationship, and your faith leader essentially told you, like, you made that marriage. It's a sacred marriage, and so just live with it and figure it out. And so faith was seen as a barrier, and now we've really flipped it through all the work, all of our organizations, and I'm so delighted to be here with colleagues who I've been working with for so many years. Together, we've been able to change that narrative and help people understand that faith can be an incredible resource if it's used correctly, if our faith leaders are trained, and if communities are open to hearing those messages. So our work is around advocacy, a lot of advocacy on Capitol Hill to create the systemic change. We house the center, the National Center on Violence, on Domestic Violence in the Jewish Community. We convene the Clergy Task Force on Domestic Violence in the Jewish Community. We convene an interfaith coalition against sexual and domestic violence. We're members of the National Task Force. on sexual and domestic violence, working really hard together in coalition. And I think that that's a really important way to change the story here. And I think that one of the, and we do this through developing economic stability. We understand how economics and how finances can really terribly impact somebody's life if they don't have access, no matter what they look like and who they are. Often people don't have the resources that other people might think they do. And that's kind of the work that we're talking about here, how important it is to ensure that every family has access to that. And we do this through our Jewish value of tikkun olam, to create a just world where everybody can thrive, live in healthy relationships, and live lives free of violence. And essentially that's our work. And there's so many programs and resources that we develop through our work, but our core mission is to ensure that everyone can live lives free of violence.
Thank you. Anne-Marie, would you like to go next?
Sure, thank you. I'm Anne-Marie Hunter from Safe Havens Interfaith Partnership Against Domestic Violence and Elder Abuse. And to introduce Safe Havens, I would say first that we are based in Boston, sort of loosely, but we are both national and local. We started locally, just working in faith communities in the Boston area. And then we were asked by the Office on Violence Against Women to take what we had learned nationally. And that was in 2003. So we've been doing that since. We are multi-religious because we found when we began that domestic violence and sexual violence and elder abuse are something that all faith communities have in common. The need to recognize and then to also within ourselves, within our own traditions, address both the resources that are in our tradition, bring those forward, and then also address the roadblocks. So we found that that was something that we had in common and that we could learn from one another. As you know, if someone else has a great idea how to do that, I'm going to certainly try with their permission to build on that as well within my own faith tradition. So we learned that we could learn from each other. We also, each faith tradition has different resources and different roadblocks. So there's a need to do internal work as well. And that's why I'm so grateful to be here with wonderful colleagues. We are working to build a kind of a united, faith-based, multi-religious, diverse, strong, and I would even say prophetic religious community voice that speaks out against any form of injustice, inequity, including abuse, financial exploitation, all the things that happen that create problems and challenges for families and for individuals. So for social justice concerns in general, but particularly as they refer to survivors of domestic violence, elder abuse, and sexual violence. We develop and provide training, resources, and technical assistance. And as I mentioned, we're national OVWTA providers. In terms of values, because we are so multi-religious, a few years ago, we got a group of faith leaders together, and then separately a group of survivors of abuse and people who are facing challenges, and then separately also a group of service providers in our communities. And we asked them all, what values do you bring to the table? And here is the list of values that all three of those groups shared: respect, safety, peace, dignity, justice, compassion, hope, safety, and well-being for everyone in our communities. And I think that answers it. I'll leave it there.
Thanks. And last but not least, David, would you like to share about what your organization stands for? I think you're muted still, David.
Okay, I'm sorry. Yes, I was. Okay. Hi. Thank you all. Thank you all for this opportunity. We come out of the Christian Catholic tradition, and really our work and what we stand for is rooted in Matthew 25, service to the least of those amongst us. Like Denise was saying, they reach out for those most in poverty and with the greatest need, and we do too. And that's kind of the gap that we fill in our community here in South Central Louisiana. We're the agency, kind of the go-to agency when there are community needs for the poorest that go unmet. And so what do we stand for? We stand for just the inherent dignity of every human being, regardless of nationality or faith, income, color, whatever. I mean, every individual has an inherent, irreplaceable dignity and deserves to benefit from all of creation and the fruits of what we produce as a community. And based on that, the inherent dignity of the person, we also realize that people are most fully human when they are fully engaged and accepted in their community. So we work with vulnerable populations to seek to integrate them and have them become parts, integral parts of our community. So that calls us to work with refugees and immigrants, who, and these days, at least in our part of the country especially, it's very controversial, being in the Deep South. It's one of the tasks that we have, that we're enabled to do that kind of work because of the relationship with ACF and support from ORR and our work with unaccompanied children, just trying to reunite them with the things that so many of us take for granted, which is, being able to visit with your aunts and uncles and your mom and your dad. And then we do a lot of refugee resettlement. We welcome numbers of Afghans this year, some Ukrainians, but Ukrainians tend to go to communities where they already have family relationships, and Baton Rouge, and the Diocese of Baton Rouge is not, the hubbub of activity for Ukrainian nationals. And then we work with other vulnerable populations. Refugees and immigrants, especially these days, are some of the most vulnerable. I mean, just kind of denied a safe place to live around the globe. So we do what we can here in Baton Rouge with those populations. But then also we have programs for recently released incarcerated men. We have services for crisis women who are in crisis pregnancies, homeless pregnant women. In everything that we do, and we do some in-home peer-to-peer mentoring and parenting and early childhood development. But in everything that we do, we try to incorporate services and resources that would help people become fully engaged, fully participants in their community. So we offer employment services, housing assistance, first-time home buyers. We have programs in a partnership. We actually help create a credit union to help give people alternatives to payday loans. And then we try to address those underlying causes of inequality and injustice in our world. And with the partnership with ACF, we're able to do that, especially with the immigrants and refugees. And that's where our primary interface with ACF comes.
Great, thanks. I think Anne-Marie had one thing to kind of tie all this together.
Well, I just wanted to add one thing that I think is in common with all of us. And that is to point out that many, many people, when they are in crisis, turn to their faith communities and their faith leaders for help. And that is a place where they have trust, and they're reaching out for help there because they have trust. Faith leaders don't always have all the answers, but they often have the connections or whatever. Training and resources are always wonderful to bolster that, but just to remember always that that trust is invaluable.
Absolutely. So the second question, Dimitri, if you want to pull that up. According to your organization's model, what characterizes healthy communities? And we were planning to go to David first. David?
Okay. Well, building on what I just mentioned, when people have access to quality education, childcare, jobs, and those things that enable them to get jobs. So like here in our community, we have very poor public transportation, and that's one of the areas that we work in and engage in is advocacy for better funding for public transportation. Access to healthcare. That's a critical ingredient of a healthy community. Safe neighborhoods, we have, as many of y'all probably have similar, stray bullets flying through neighborhoods, and, helping people, as one family we helped relocate after one of the storms here, one of the disasters, one of the hurricanes, who was thrilled that, he and his wife and his sons can sleep through the night and they don't hear gunshots going off, something that at least I kind of take for granted, and most of us in the country do. Employment opportunities, so we have relationships with employers in a lot of entry level positions, because people who come to us looking for employment usually have tried all other avenues, and they tend to be, chronically unemployed, or refugees and immigrants, refugees especially coming into our community, who our employers love them because they're willing to work and do just about anything to get their first paycheck and begin building a life of self-sufficiency. Access to healthy food. We have food deserts in East Baton Rouge Parish. We have some of the most concentrated areas of substandard housing. So, all of those things make for a healthy community. Access to healthcare, jobs, transportation, food, and safe and secure housing.
Thank you. Does someone else want to share what makes healthy communities to them? I see Deborah's hand up.
Thank you. So for JWI, healthy communities, like healthy families, have shared values and shared power, and everyone feels welcome and included and has access to the services and the supports that they need. We are working really hard to ensure that all the organizations and institutions serving the Jewish community specifically are trauma informed and survivor centered. And our work really focuses on around domestic violence and sexual assault and stalking and dating abuse, but those 4 crimes. And so we actually have a national program now with the JCCs, those are the Jewish Community Centers found in most Jewish communities, where many people go through it, whether to play basketball or take a class or go to a book fair, and have early childhood education. We want to be sure that all the teachers there and all the staff there and the support staff there understand what it means if a survivor is coming in who is a victim of experiencing domestic violence, and the trauma that the child has experienced, and how do you help that child navigate that and become more resilient and grow up to be the fine person that we know that they can be, and to get the supports to the survivor themselves. And unless all the organizations and institutions serving our communities are trauma-informed, survivor-centered, and can provide those services in culturally competent and sensitive ways, we're not going to create the kind of communities that we want to have and that we know we can. In the Jewish community, we're highly networked, we're a highly organized community, and we have organizations, national organizations with many local iterations of them, and together as these networks, these are thriving networks where many people know each other and can help people gain that kind of access. And so what we're striving for is that all those functioning organizations are able to serve their members and to serve the members of the community with those kind of supports and services, and really be trauma informed around it.
That's great. Thank you. Anne-Marie, I know you wanted to jump into it, and I see Denise too. So go ahead, maybe Anne-Marie and then Denise.
Be quick, Denise. I don't want to repeat anything anybody has said, and it seems like we have a lot in common, but I just wanted to add a couple of things. One was a place where people do not have to choose between their faith and their safety, that these two things are coherent. And second thing I wanted to mention is that we really are working to end all forms of violence and abuse. And we really believe that to do that, we need to address racism, ageism, classism, homophobia, sexism, xenophobia, etc. And so we see that wider social justice piece as absolutely critical to the work we're doing to build healthy families, to build strong individuals, to prevent violence in the next generation, and to build those communities where we all want to live and thrive.
Go ahead.
Well, and I'm going to piggyback on that. It's interesting for us because, of course, we are all part of Ibrahimic faiths, right? So much of what everyone has said, of course, is inherent in what we believe in and what we are working for as well. And I think the only piece I want to add in, sort of to wrap it up, is this idea of feeling at home within that faith and cultural community. Islam is the most diverse, according to the Pew Foundation, the most diverse faith tradition in the United States at the moment, and diverse in terms of language, in terms of culture, in terms of even belief system, immigration status, all of those kinds of things that you've heard my colleagues talk about. One of the commands that we have is in terms of breaking down boundaries by knowing each other. And that means being comfortable in telling your story, in not having information about you misinterpreted. When we look at sort of the way that media is portraying all of our faith communities, but in specific in terms of Islamophobia, and this idea of really feeling that you have to defend against who you are instead of being able to share in kind of an open way. So when we think about healthy, happy communities, we think about folks who are able to be who they are, absolutely sharing that, but not feeling the need to hide that, to be something else, and to be able to spread information about their belief system, their cultural system, their linguistic system, their faith tradition, without sort of being either targeted or having that information sort of used against them. And that's what we found is a lot of the work that we do within mainstream communities is explaining this is Islam and gender, this is Islam and marriage, this is Islam and domestic violence, because there is so much misinformation and so much polarization in our communities.
Yeah, thank you all. I want to live in wherever communities you all set up, because it sounds wonderful. Safe neighborhoods and no racism and trauma informed, and you feel at home. Sounds very lovely. For our third question, we're going to put up on the screen as well. How do you support prevention for families or communities? And we're going to go to Deborah first.
Thank you. So JWI, our prevention work really begins with teens, I would say, with young adults, aside from the work that we're doing with the preschool educators. And because we believe that young adults are, times when we form these kind of really important relationships, and friendships are so important, and relationships are so important, and really can set you up for the rest of your life if you have healthy relationships and understand those components. So we're multi-grant recipients from OVW around engaging men and boys, and we think that, and we believe that engaging men and boys as allies in this work is critical. Teaching them how to be bystanders, teaching them about what is a healthy relationship, what is consent, and how can they use their position of privilege essentially to help families and to help their own relationships be healthy. And Jewish men and boys, we specifically hone in on around concepts of masculinity within Judaism and the kind of male privilege that men hold within the faith, and also with fraternity men. So Jewish fraternity men has been our sweet spot for a number of years. But we also really believe that families and Jewish texts have so much to inform this. So we've created multiple resources for families to use, whether it's around the Sabbath table where people gather on a Friday night and have a very relaxed, beautiful meal, and it's a great time for conversations. We provide resources for them using Jewish text as the bouncing point to create those kind of important conversations around health relationships, and through that create that prevention work. We also just received a grant to be a technical a TA provider around multi-faith for providers working in different faith communities around engaging men and boys. So we're just starting that work, but again, it's going to be a fantastic opportunity to talk about prevention through the lens of faith, and to be sure that everyone doing that work is culturally competent and understands what the faith talks about and how to talk about things like dating and sexual consent and rape within the context of the faith groups, that everybody who receives those programs understands them within their faith, and can really use that information to prevent violence against women and girls, and all people.
Thank you. Does someone want to follow on Deborah's?
Think I will, because PFP is in fact a prevention organization, I'll try to slide in again using piggybacking off of so much of what our colleagues have said. For us, it's about going to our sacred text where there are models where all of these sort of because justice is so important within our community, the ideas have been already propagated about the roles of family, the roles of parents, the role of elders, the roles of men and women and family formation. So for us, it's about sort of going back and reminding folks that this is where we started from. This is not something foreign from who we are. As I said, we run programs as well, working with male allies, working with youth, working with folks at critical junctures, whether there's domestic violence, whether it's parenting, whether it's divorce and the grief around those kinds of things. But the other piece that we do in terms of making sure that the programs are local is, in fact, as a national organization, is doing all of our training of trainers. So we are a very small core group, but what we do is to work with trainers around the country. So we have 20 training affiliates around the country. We train with them, but we also train around them. So we get information from what's going on in communities, where the obstacles seem to lie, and are able to address those, like, as I mentioned, through research, because we need to know more about what's going on, through resource development, so that we have materials that make sense in the languages that people speak, in the, addressing the concerns, the very specific cultural and faith concerns that they have, and then really getting the use of social media as our way of sort of putting peanut butter across the, all of our communities, and being able to talk about things that maybe folks are not having conversations about, or that are new concepts for them. The idea, again, of Islamic male masculinity, the ideal of nonviolent parenting, the idea of sort of global citizenship within our communities, addressing things that are not comfortable traditionally, that folks have been not wanting to talk about, when there's domestic violence, when there's child abuse within their communities. But those are the kinds of the things that we're working on, because again, our goal is the elimination. Our stated goal of our organization is the elimination of domestic violence within our community. And some people are like, well, that's a crazy goal. But that really is our goal. So prevention is 100% of what we do. And then, of course, using our partners within the federal, local, and faith-based communities to really support that change of thought. That change of, aside from resources, but really that deep change of thought and the deep change of social expectation.
Thanks. So you have to set high goals for yourself. That's the aspirational. Anne-Marie or David, do either of you want to contribute to this question?
I'd love to jump in if I may. And again, I want to just say thank you to the two people who just spoke, Deborah and Denise. I'm going to try not to repeat you, and so much of what you're doing with young people, with sort of young adults, et cetera, is also work that we are doing. We encourage congregations, for example, to invite experts from the local community to come in and do prevention training, or to talk to our young people, or blah, blah, blah. I guess one of the strengths of the faith community that I'd like to point out is that we generally include people of all ages. And so that's one of our strengths as well, is if you're talking prevention, we can talk across the lifespan, which is really exciting, because when you're working with very young people, you can prevent, but also we have to remember that we also include older adults who often really trust their faith communities and their faith leaders. So when we look at older adults and their needs, it's a really good place to bring in resources, to connect people to services, to think about perhaps where they may be facing a challenge such as abuse, and how we can talk about healthy relationships as well, how we can break the silence in our communities so that people can talk about these issues to begin with, and be more likely to reach out for help. And we're also all about partnerships in the sense that we don't believe that faith leaders are really experts on any of this. I mean, faith leaders aren't usually experts on refugee resettlement or job training or any of that, but we should be conduits. I'm saying we as a faith leader should be conduits to services within the community. So we're really all about building those partnerships so that when someone comes to me as a faith leader, yes, I'm not an expert on whatever their issue is perhaps, but I should know where in the community they can find help and make sure to make that linkage, but also always remembering that as the faith leader, I am trusted. And so usually I've met those people myself. I've sat down with them. I found out who they are. I have their card, their brochure, blah, 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 because I don't want to refer someone to someone who I can't trust myself. And so what I'm saying to my congregants when I refer them is, I trust this person and I think you can too. And I think that's a bridge from the faith community out into the wider community where services are often available. But let's make sure